Hey, it's Birdman for Summit Healthcares, and today we've got a couple guests. I've got Jennifer and Ann, and you're with the Integrated Behavioral Health Department with Summit Healthcare. Is that correct?
That is
Yes.
correct, yes.
Okay, I got it right, or is it now? Is it changed, or is it that's the actual functional name?
That is the functional name. It's just
Okay.
a new department.
So explain to me, what is that exactly? What is integrated behavioral health?
Well, currently it's integrating, obviously, we're integrating behavioral health or mental health into the doctor's offices to coordinate that care for the overall health of the patient. So, what we do is the PCP can make a referral to us, and then we meet with the patient and see what their needs are. Sometimes it's just removing those barriers to their health issue, like diabetes or weight management. And other times it's more specific around anxiety or depression, that mental health issue that's
Okay,
affecting their overall health.
you said PCP. So
Yeah,
what's a PCP?
a primary care physician.
Okay, so that's the
Yeah.
doctor I go to
Hmm.
like normally, correct?
Right.
Mhm.
Okay, now integrated, is this a different, so typically we've looked at physical health and we've looked at mental health and they've been separate and sort of like in different rooms.
Oh, absolutely. Yes.
Okay,
Traditionally, that
Yes.
is the
Mhm.
practice.
we're starting to think about this as being that they actually have a correlation or they affect each other, right?
Correct.
Absolutely.
Okay, so talk a little bit about that.
Well, I think we are realizing more and more that um, you can't separate your behavioral health and your physical health, or your mental health and your physical health. They influence each other on a daily basis, and so trying to coordinate both of those in the same location to make it easier for patients to have access to that care is kind of the goal here.
Okay, and Ann and I were sort of chatting before you came and talked about the fact that physical health is easy to see, isn't it?
Mhm.
Correct.
Yeah,
Yeah.
if you break an arm, it's like, oh wow, look like broken arm. But if you've got something that's
Mhm.
caused you a little bit of a thinking loop or something like that in mental health, it's not easy to see.
Mhm.
And sometimes people want to say, well, just buck it up and just suck it up and get going. But they don't say that to somebody with a broken arm, like, well, just suck it up and start picking stuff up, right?
Right.
Correct.
Yeah.
Right.
So how do you address the understanding, and where's the bigger understanding? Is it from the actual patient or is it from others when it comes to mental health? I don't know which one of you might want to talk to that.
It just depends
Yeah.
on it. A lot of it's cultural, that perspective of
Mhm.
just pick yourself up. And other, as we make progress, there's more awareness that there is more going on. I mean, a basic example is if I have a health issue, I'm going to be stressed. And if I become chronically stressed, that can lead to anxiety. So I can have anxiety out of
Mhm.
that, which is not going to help my physical condition. And
Mhm.
anxiety also can lead to depression because when we're anxious, we don't sleep. When we don't sleep, we can see depression come in. So, out of even just a physical health issue, I can
Mhm.
develop anxiety or depression, or it can go the other way.
Mhm.
I hit a major stressor in my life, I become depressed, I don't have energy, I stop taking care of myself, and now I'm going to have some health issues come in.
Mhm.
Okay, in the past we've seen where it's like you don't expect a cure out of
Right.
depression, or you don't expect a cure, but there is, and then obviously sometimes physically you don't have a cure to some of your physical
Mhm.
ailments, but it is possible with some of the mental ailments that we can see a cure. Is that do I understand that correctly?
Absolutely.
Okay.
Right. And from my perspective,
Mhm.
there's the genetic form of a mental health issue, which is
Mhm.
bipolar schizophrenia. That's a different kind of treatment versus an environmental situation. Again, you're going through life, you hit a major stressor, and then depression
Mhm.
develops. That's definitely treatable. So it
Okay.
just
Absolutely.
depends. That's why we do an assessment
Mhm.
to see what's going on.
Okay, so
Yes.
one of the most accepted forms of depression or mental situations is postpartum depression.
Oh, absolutely.
So
Mhm.
maybe if we start from that
Mhm.
understanding, because we understand that that can happen, then you can heal from it and you can move on, correct?
Absolutely.
Okay, so does that occur? And what are the things besides depression, or is it really sort of depression is the thing?
I'd say depression and anxiety are two of the most common things that result out of stress and lack of social support or physical health problems or social problems that we stumble upon in life. I think it would be easy. I mean, we could easily say that over 50% of your population is going to experience either one or the other at some point in their life just based on circumstances.
Okay. Now you say integrated, so that gives me an idea. Now, typically we think about separate offices. Where are you guys located, and or do you come into other areas?
We're each located in a clinic. So I'm in Cholo in the
Mhm.
walk in clinic, but I also cover the Heber Clinic and the Eager Clinic through telehealth. So if they have somebody walk in,
Mhm.
I can see them through the iPad.
Oh, very good.
Yeah.
Awesome. And then
Yep.
you're located.
I am located, I'm kind of co-located in both Snowflake Medical Center and Snowflake Taylor Family Medicine. And I'm also Ann's backup for telehealth in Heber and Eager.
Very good. Yeah, telehealth makes it a lot easier to get to
Right.
anywhere, obviously.
Mm-hmm.
Cool.
Mm-hmm.
What else would people want to know about integrated behavioral health?
We're usually pretty nice.
That we
We're
are.
high.
True.
A lot of people get very
Yeah.
anxious when they
Yeah.
think about seeing a mental health therapist. Just again, that
Well, that comes
idea.
once again from the stigma, the fact that
Yeah.
it's easy to understand. I broke a finger. I'm going to get a splint. I'm going to
Right.
get this. I'm gonna...
Right.
They're like, well, what are you going to do to my mind? I don't understand. Is it,
Right.
Right.
it's that unknown, isn't it?
Yeah.
Correct.
And a lot of it is just about helping patients or clients develop the tools that they need to navigate life a little easier. It's not about some great big mysterious, we're going to delve
Yeah.
into your mind or
We're not
anything. It's
Freud.
just about, adding some tools and some things maybe they hadn't thought of before to help them have a fuller and happier and healthier life all the way around. So it's not a scary process, just a new one.
So now let me ask this, because I've seen it where dentists used to only go to dentists just when you had an issue, and then we've started to understand, wow, dental health is important, and we got to do that all the time. Mental health has sort of been the, well, I'm broken, I got to go get fixed. Is there, or do you already do? Is there some sort of thing on the future that looks at we address mental health as something that we need to monitor and be okay with, sort of like checking up on it, like a physical?
Yes, and that is in our clinic, the patients, if they choose, can do a depression screening. And we encourage that every year just to see where their rating is, if they flag anything. And, the sooner we catch it, the better, because then treatment's a little bit easier. So we are starting to do those screenings. I wish they would teach it in high school,
Yeah.
just as
Yes.
part of the health class, how to keep your stress reduced.
Mm-hmm.
Because to me, chronic stress is like the key factor to a lot of it.
The thing.
Yeah.
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 Pretty much.
Very good. One, as a guy, I know, us guys, we're in the complete denial of everything, so we don't do any screening up until they say there's an age and you got to go.
Right.
So, but this
Right.
should start earlier than later, right?
Right, correct.
Mhm.
And also keep in
Mhm.
mind we address addiction. So those substance abuse issues should
Mhm.
be screened out early as well.
Mhm.
But sometimes we don't always do that.
And I know they talk about addiction as substance, but it's also, there's internal substances that we can get addicted to, whether it be adrenaline or other
Oh,
type things, right?
absolutely.
Mhm.
Yes. You're very aware. Yes.
Yep.
Good. Awesome. Okay.
Absolutely.
Anything else, ladies, that we need to think about?
Well, I think to keep in mind, the mental health profession is moving more towards a medical model. So we do have different layers. And as master's level therapists, which we are and we're licensed, we act more as that primary care physician in our system where we do an evaluation. And if we feel like somebody needs further evaluation or more intense treatment, then we do refer out to other organizations that can provide that service, whether it's psychiatric or case management, things like that. So that urgent care. So we do refer over to the urgent care facility here in town, and then if needed, they do further evaluation.
Very good.
Yeah.
Yeah, it's that we've all heard the stories about where someone has decided to not do the typical physical treatment for a physical ailment, and they've gone mental positive, and they've done all these things, and all of a sudden they get healthier. So that sort of goes in line with the fact that maybe the mental was causing more damage physically than was thought.
Yeah.
Absolutely. I think they're finding a lot more of that just in the scientific community. They're understanding more how our thoughts influence the way our minds work and the way our body chemicals work, and they all work
Correct.
together. So if
Yeah.
you influence one, you influence the whole thing.
Very
Yes.
good. So talk to me, just give me your full name and what your title is there.
My name is Jennifer Rivera, and I'm a licensed professional counselor. Our title with the Integrated Behavioral Health is a behavioral health consultant because we're consulting with the doctors regarding their patients.
Okay.
Right. And my name is Ann Unrast, and I'm the same. I'm the behavioral health consultant licensed in the state of Arizona.
Hey, that's going to be it for this episode of Summit Cares. I'm Birdman saying, be healthy.